According to a study published in 2007 by the Population Reference Bureau, by 2006, 25 million people had died and more than 35 million were living with HIV. Additionally, the study stated that in 2006, approximately 4.3 million people were infected with HIV. Even more alarming is the fact that there are countless undocumented cases, as well as many who are unaware that they have contracted the virus. 1 out of 4 Americans with HIV do not know they have the virus. But consider this. The same study concluded that out of the total population living with HIV worldwide, about 63% live in sub-Saharan Africa, an estimated total of over 25 million people. The AIDS crisis continues to bring about death and destruction all over the world, but the sub-Saharan region of Africa is undoubtedly the most vulnerable and hardest hit area by this seemingly unstoppable epidemic. HIV, or human immunodeficiency virus, specifically attacks the body's immune system. The virus overwhelms the immune system by replicating itself through the body's healthy white blood cells, and eventually the immune system becomes too weak to fight off other bacteria and illnesses. At this point, in the late stage of the HIV virus, it becomes known as AIDS, or acquired immune deficiency syndrome. Diseases known as opportunistic infections take advantage of the body's weakened immune system and are the overall cause of death for those who are infected with AIDS. HIV is transmitted through bodily fluids such as blood, semen, vaginal secretions, and breast milk. In addition to sexual transmission of the disease, it can also spread through the sharing of needles from mother to child and through certain donor products. Additionally, HIV spread through some blood transfusions that were done prior to 1985. Early symptoms of HIV include flu-like symptoms, and many times these symptoms are not apparent. A window period occurs between the time that a person is infected with HIV to the time that the body creates enough antibodies against HIV so that the virus is detectable. Symptoms of the late stages of HIV include chronic yeast infections, fever and/or night sweats, easy bruising, exhaustion, mysterious rashes, purple-colored lesions on the body, weight loss, and chronic diarrhea. Once the virus has advanced to the AIDS stage and the T4 cell count has dropped below 200 per cubic millimeter, common opportunistic infections include, but are not limited to, Kaposi's sarcoma, pulmonary tuberculosis, candidiasis of the esophagus, trachea, bronchi, or lungs, toxoplasmosis of the brain, severe bacterial infections, invasive cervical cancer, lymphoma, and recurrent pneumonia. Other symptoms include loss of vision, nerve and brain impairment, and various psychiatric disorders. There is no vaccine for the HIV virus. Treatments such as an antiviral cocktail are available, but are extremely costly and around $7,000 per month. Such cocktails keep the viral count low, but HIV mutates quickly, so there are available treatments only work for so long. Reverse transcriptase inhibitors and protease inhibitors have similar effects on the virus. Healthy behavior can also aid in prolonging the lifespan of those who are HIV positive. Without receiving any treatment, people who are infected with HIV usually develop AIDS in the next 8 to 10 years. But for those who receive some sort of treatment, AIDS may not develop for 10 to 15 years. In terms of sexual activity, the best forms of prevention for this virus are abstinence, delaying the onset of sexual activity, staying with a mutually faithful partner, limiting the number of sexual partners, and using condoms regularly and consistently. The use of new and sterile needles, and preventing transmission between mother and child also lower the number of infections. This crisis demands funding. Millions of people around the world suffer from this virus, but more so in developing countries, and especially in sub-Saharan Africa. For example, according to the Population Reference Bureau, the adult population of South Africa is projected to be about 6 million people smaller by 2015. The total population of South Africa in 2015 is estimated to be 50 million, which is 15% lower than a non-AIDS scenario. The funding would go toward educating people about the virus, how to prevent it, and research that would go toward a vaccine and affordable treatment. According to the statistics from the World Health Organization, approximately $3.5 million was spent by governments on HIV and AIDS in South Africa from domestic sources. In order to properly address this crisis in all of sub-Saharan Africa, I request that $2.6 billion be allotted toward treatment and prevention of HIV in this region.